Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is stroke recovery. We will be discussing what a stroke is, what to expect after a stroke occurs, and what the different types of recovery are. Joining us today is Mallory Schonk, speech-language pathologist at the University of Maryland Upper Chesapeake Medical Center, and Vicki Alsop, occupational therapist for the University of Maryland Upper Chesapeake Medical Center. Welcome to our show, and thank you so much for being with us today.
Thank you for having us.
We're happy to be here.
Great. So if you both don't mind to please take a moment to introduce yourself and let the audience know what your connection to the topic of stroke recovery is.
My name is Mallory Schonk. I'm a speech-language pathologist. I work at the University of Maryland Upper Chesapeake Health, currently in outpatient rehab. And so I see patients frequently who have suffered from stroke and help them in their rehabilitation.
That's awesome. Thank you.
And my name is Vicki Alsop. I'm an occupational therapist. I've been an occupational therapist for 25 years, and I've been at Upper Chesapeake's outpatient center for the last 15 years of my career. And I'm board certified in physical rehabilitation. I have a lot of experience with neuro patients, and my favorite population of neuro patients to treat is stroke. So I'm really excited to be here today.
Great. Thank you both so much. I'm just excited to have you both.
Of course.
So if you can start off by explaining what is a stroke?
So a stroke, it's often called a brain attack or a brain injury, really. And it's any time that there is a loss of blood flow to the brain, and this can result in permanent damage to the brain.
Yeah, and actually there's a couple different types of stroke. There's one called an ischemic stroke, and that occurs from a blockage in the artery, and that's what basically caused the lack of blood supply to the brain. So you're not getting oxygenation, and that could lead to cell death and damage to the brain tissue. And then the second type is called a hemorrhagic stroke. And that's also going to cause cell death because of a different reason, though, and that's because there's bleeding in the brain or around the brain. So that pressure on the brain can also cause brain tissue to die. So it's, really important to be careful not to have a stroke.
So the two types of stroke it was ischemic and hemorrhagic. Is that correct?
Right.
And those are the two main types, correct?
Yes.
Okay. So I know that this is something that's not really talked about, but the stroke is actually the fourth leading cause of death in Harford County in 2020. And if we take out COVID, it's the third leading cause. So it's really important that we're kind of discussing this today. What are the signs and symptoms of a stroke?
So there are many different signs and symptoms of stroke. I like to think of the acronym BFAST. So the B, it stands for balance. So if you notice any change in your balance that's like new onset and sudden, that is definitely something to look out for. The E, it stands for eyes. So any change in eyesight that could occur, it could be in one eye, it could be in both eyes, it could be blurred vision or a loss of vision. That is definitely another sign of stroke to be on the lookout for. The F, it stands for face, which is like facial droop. So if you ask someone to smile and you notice that one side of their face is not moving in symmetry with the other side. The A stands for arms, so noticing any like numbness or tingling or weakness. Frequently with stroke, you'll notice that the deficits are on one side of the body because the infarct or the stroke occurred on one side of the brain, and that often presents the symptoms on the other side of the brain. And the S in BFAST stands for speech. So noticing any change in communication, that could be slurred speech, difficulty coming up with words, difficulty understanding language. So if you're thinking that someone might have a change in their speech, if you ask them to repeat a simple sentence such as the sky is blue, and then seeing how they do with that task is a way you could assess their speech. And then the T stands for time to call 911. So it's really that call to action, like you recognize these symptoms, any one of them could be present. And something I think that might not be encompassed in that acronym is a sudden onset of a headache too, or confusion can also sometimes be a sign of stroke.
Okay. What can stroke affect?
Oh my goodness, there's so many things that stroke can affect. Typically, you want to look for any one of these signs also if you're having a motor function impairment, meaning you're having weakness on one side. That could be a sign. You could have a sensory impairment, and that could just be you don't really feel normally. It might be tingling, it might be numb. You may not sense light touch or deep pressure, or even be able to recognize temperature changes like hot and cold. So that's a sensory change. A visual change, and this could be in the form of visual perceptual, meaning like, depth perception could be off, or you could have like a one half of your eye is you're seeing differently, so you're only seeing partial field of vision, so you're not fully seeing. It's half on one eye and half on the other. So there's just so many different visual changes that could occur. There's balance issues that could occur where you're off balance. Coordination issues, also something that could also occur is like a behavioral change. You could be a little bit impulsive, or you might be inappropriate. Often you could have some, signs of depression from a stroke. So those are behavioral changes that often are underlooked. So you want to make sure you're definitely paying attention to the coping depression aspects as well.
That's interesting.
Yes.
And so when does recovery start after a stroke?
Oh my goodness, immediately.
Immediately, definitely.
So as soon as you recognize the symptoms that we've reviewed, you should definitely be paying close attention, because the quicker you get in for an assessment to figure out what kind of stroke you had, the treatment begins right there. And then your rehab intervention begins as soon as you're medically stable, and the physician will recognize, for example, what intervention, what discipline is needed for you to have care. So you might have speech needs for swallowing, you might have occupational therapy needs for some self-care things, or your arm rehab, physical therapy for functional mobility. So immediately, just, as soon as you know you have a stroke, your recovery begins.
I see like a definite correlation. So if you have symptoms of a stroke, immediately call 911. If you have a stroke, immediately start recovery. So there's a lot of immediate attention, I think, that goes around with stroke that we want to continue to emphasize to people, is that, you don't want to waste your time with anything, signs, symptoms, recovery. You want to take care of yourself right away. And so I think that's really important. So I think that's been like a theme, I think, with stroke.
And even the acronym that you use, the Be Fast, is definitely, pushing that immediate need that attention to that.
How long can stroke recovery last?
So stroke recovery really, I would say, could last a lifetime. Typically we see the most extreme and significant improvements in the immediate days and weeks and early months following a stroke. But people do continue to make improvements, I would say, beyond a year and beyond. As outpatient rehab therapists, we are often treating patients who may have had a stroke several years in the past and now are experiencing kind of long-term side effects from that, like either new onset weakness or difficulty with mobility or difficulty with their thinking. So I would say that the most intense recovery and improvement that you see is usually within that short time frame, like within 6 months. And then after that, sometimes the recovery can be more slow, but progress can still be made.
Able to make progress, right?
And obviously this is dependent on how fast they go to the hospital to be seen, how fast they kind of recognize the symptoms, and starting that recovery right away, of course.
Absolutely.
So according to the CDC, Your stroke treatment begins the moment emergency medical services, or EMS, arrive to take you to the hospital. Why is it so important to call an ambulance instead of having someone drive you to the hospital?
Well, it's definitely important to call 911 to have an ambulance take you to the hospital, because as soon as they get on scene, they begin the triage process. So they immediately assess what your deficits are, and they're making decisions that are going to impact your treatment. So they recognize what would be the best facility for you to go to, because there are specific stroke sites and hospitals that are best equipped to deal with the deficits that are associated with stroke. And they are also in contact with the hospital. So working in outpatient rehab, we actually hear the overhead pages and we'll hear them say, stroke on site 5 minutes. So that is actually already gathering the team in the emergency department. So they're prepared when they come, and they are immediately like getting the resources they need, and the hope is that if you're within a specific time frame, it's about 4.5 hours, if you have had a specific type of stroke and meet the certain criteria, there are medications that can be administered to actually break up the clot that is in the brain causing the stroke, so that you can have some of those deficits reversed and hopefully prevent that cell damage in the brain.
And prevent that long-term disability.
Yeah. So it seems like it takes a village as soon as from the start of, calling that 911 until you get to the hospital. It's not just the doctor, whoever is the provider at the hospital. It's a bunch of different people. So thank you all. How can you encourage recovery at home?
That's a really great question. So in a lot of ways, actually, and I would say it starts from that emotional support that you gather from your community, from your family, your friends, your church members, because you need to be in a place where you have the support to motivate you so that you're not coping alone, and that you realize and recognize that there are things that you can do at home to help your stroke recovery. On that note, once you have those good support systems in place, you have that strong emotional support, there's things around your house that you want to be able to have set up for you so that you can maximize your safety and maximize your ability to be as independent as possible. So for example, like as simple as putting in a grab bar in your bathroom, or a chair in your shower, or having the appropriate assistive device, or having a foot brace. Those kinds of things will allow you the ability to be as safe as possible within your home environment, which will allow you to still be active, which is super important. You don't want to just be sitting around. You still want to be able to engage in exercise. Exercise is healthy for everyone, and really, really important for people who have had a stroke to continue to be able to be active. Some people are not able to be functional ambulators right away, or maybe even ever, but there's still exercise that you can do from a bed level, from a wheelchair level, and walking. If you can walk, it's great to walk. So being able to know, probably with the guidance of a clinician, a therapist, what's safe to do, what maybe you need a caregiver next to you to help coax you or support you or guard you, those things are important. Having a home exercise program that is dedicated for your specific needs. So if you have deficits in your arm, you can have exercises specifically for those deficits, or your leg, or for swallowing. What people don't recognize is there's weakness not just on that one side, arm and leg, but including your head, which is your tongue and your vocal cords and things of that nature. So you might have to have exercises for your tongue and for your vocal function and for swallowing, muscles related to that. So there's a lot. And then also, just basic good nutrition and good sleep hygiene are very, very important things, and I think simple things to incorporate into your home recovery.
Wow, that is definitely a lot. And again, I think having that support from your family and your friends, I think is probably really important for that those different types of recovery that you mentioned. But all really, really important things. And some of the stuff too is like almost the stuff that we should also think about before we have a stroke. Like you mentioned, the exercise, the eating well. So I think that's really important. So just continuing that throughout your life.
Yes.
What are some deficits that can exist after a stroke?
So that's a really great question. If you look at some of the areas that I listed that could be affected, like the weakness and the motor function, these could lead to really big functional deficits. Like probably the most basic one would be when you're walking. Can you walk? Can you ambulate? Can you get around? Being able to take care of your basic self-care needs, washing up, getting dressed, home management, being able to do things around your house, laundry, make a meal, being able to safely swallow and not aspirate, because if it's not going down into your stomach, it could be going into your lungs. So things like that are hugely important, and you don't want to have those kinds of functional deficits. I don't know if you want to elaborate on any of the speech things, but
I think it's neat because within our disciplines, we each get to kind of focus on specific areas that and the deficits that could be associated with speech, with stroke. So as Vicki touched on, as a speech pathologist, something a lot of people don't know that we do is we work on swallowing. So one deficit that we frequently see after stroke is that people can have difficulty with their swallowing, and so things can go down the wrong way and end up going into their lungs rather than going into their stomach, which is associated with respiratory difficulties and can lead to pneumonia. So as a speech pathologist, we are assessing swallow and making recommendations for diet modifications, so perhaps changing the texture of the foods or the liquids that they're drinking so that they can eat and drink safely and contribute to their overall recovery.
And then just functional deficits like being able to drive or being able to work or being able to take care of your child or your grandchild, or the leisure activities that a lot of people enjoy, how you maybe won't be able to engage in them, or you have to modify how you do engage in them. So there's a lot of functional deficits with stroke.
So what are our different types of stroke recovery? So we have a speech language pathologist here, we have an occupational therapist here. What are the different types of stroke recovery?
So typically, as soon as someone comes into the hospital, like we said, the multidisciplinary team is kind of activated. And so when someone has a stroke, they will have a physical therapy consult while they're in the hospital. So they'll be looking at their mobility and deciding, is it safe for them to be walking right now? Do they need an assistive device? Things of that nature. How can we safely get this person up just to go to the bathroom, really? And then an occupational therapist, which is Vicki's domain, they're really looking at those kind of activities of daily living. So things like dressing, bathing, keeping a home, things like that. And then the speech pathologist, we work on speech and swallowing and communication and cognition in conjunction with occupational therapists. And there really is like a continuum of care when it comes to rehab services. So in acute care, we're often assessing and seeing what those deficits are and determining what needs a person may have to help determine, is it safe for this person to return home? Could they return home with a certain level of support, like with a caregiver or nursing care or therapy services in the home? So the acute care services are provided by rehab, and then there's also acute rehab facilities. So in Harford County, we don't have an acute rehab facility here. The University of Maryland does have the Rehab and Orthopedic Institute, which offers acute rehab, and when someone is recommended for that, that means they get 3 hours of rehab a day. So it's a very intensive program. Yes, and we oftentimes recommend people who've had a stroke to go to those to get that service, because like we said, that immediate time after your stroke is usually when you see the best recovery. So we encourage people, put in the time now, you'll see the long-term benefits from it. So other options besides acute rehab include subacute rehab, which there are some of those in the community in Harford County, and they again offer rehab services and nursing services, but it's usually a lesser intensity and amount of time that they would get therapy per day. Also, sometimes people need to go to a nursing home after a stroke, again, to continue their medical care, and they can get rehab services there as well. And then there are home health services for where you can get rehab services in your home, and you typically have to be homebound in order to qualify for that. But it is nice because they can look specifically at your home setup and see what needs you might have and how those can be addressed at home.
Like that grab bar and that seat.
Yes, definitely. And then beyond that, there are outpatient rehab services, which is where we work. So people who are now back in the community, but then continue to have deficits that they want addressed and continue to make improvements.
That's great. So for answering, what is stroke rehab? I mean, it's a wide variety of things. So you mentioned it was acute. We can also do, rehab at the home. They might have to go into a nursing home, as you mentioned. Anything else too that we're missing for stroke rehabilitation? I think
I think kind of like Vicki mentioned, it's like anything that is functional for a person, I would consider part of their rehab. Like if they're able to get out of the house once a day and go to the grocery store with their wife and they get some steps in while they're doing it, that's part of their rehab. Anything that's contributing to their overall quality of life and their recovery is great.
Yeah. You both have such an important, role in this type of rehab. So I know a lot of people, when they say occupational, they think, oh, this has to do something with our job or something. But no, it's really your everyday, your everyday life. And stroke can affect so many parts of your body that, you're so crucial. And then, learning about the swallowing is really interesting. So, having someone like you as a speech language pathologist to kind of help them, and bringing in the nutrition aspect of it too as well. It's really, really important. So thank you both so much for all that you guys do.
We love it. We wouldn't have it any other way.
Great. So according to the CDC, 1 in 4 stroke survivors has another stroke within 5 years. How can survivors prevent another stroke from happening?
I think that really brings in to thinking about the risk factors that are associated with stroke. So some that come to the forefront of my mind are things like diabetes. So if you have uncontrolled blood sugars, that is definitely something that's really important to address. Also like high blood pressure, high cholesterol, heart disease. So these are all things that preventative medicine, so seeing your primary care provider regularly, they're very important to lowering those risk factors and hopefully reducing your risk of having a stroke.
Yes.
Yeah, and we've mentioned multiple times, it's so important to see your primary care provider, your family doctor, at least once a year. I know for some people it may be more than that, depending on their medical situation, but at least, seeing that provider once a year, getting your regular physical, getting your checkup, getting your blood work done, I think is just so important, and really just kind of ties in with that preventive aspect for stroke, because to kind of see what our insides are how we're functioning, I think it's just really, really important.
Definitely.
How about resources that are available in Harford County for stroke survivors?
So at Upper Chesapeake, we do have a monthly stroke support group. So that group meets the second Wednesday of every month from 10:30 to 12 in the Lyle Sheldon Conference Center. And it is open to anyone who has any connection to stroke, really, stroke victims, but also their caregivers, any medical providers who might be interested in it. So I think that is a really great resource, because it's a place where people are welcome to come and share their experiences, talk about anything they found helpful, any difficulties they've been experiencing, and really kind of bring the community together in that way.
There's senior centers and community centers. We often, once we discharge from outpatient therapy, we don't want to just kind of say, oh, you're on your own, good luck, give them some resources. Where can you find this equipment to be able to continue your workouts? What's accessible in the community for you? Things like that. So we often recommend different areas where you have the right equipment and the right accessibility to be able to continue workouts after discharge from an outpatient therapy center.
Yeah. And from that preventive aspect, we have diabetes prevention program classes here. We have smoking cessation classes. So there's so much that Harford County has to offer to help, not just with the rehab part of it, but the preventive spot as well. So it's really great. Is there anything else that you both would like to add about stroke recovery?
I mean, I feel like it's a multidisciplinary approach. You may even have experts like social work involved for community resources. You may need a psychologist or psychiatrist for coping with your stroke. You'll definitely want to have your primary care, but definitely if you've had a stroke, you want to have a neurologist too. You want to have those medical experts on board. The goal for stroke recovery, as far as I see it, is to maximize your independence, improve your quality of life, and just keep living. And if you can recover some of the deficit areas, that's great. But if you can't, then we help you also adapt with it. Learn compensatory strategies to being able to get around or get dressed or swallow or communicate, sometimes with facilitation boards and different devices. So there's a lot of ways, whether it's gaining back what you lost or compensating for it, that stroke recovery is super helpful and beneficial for patients with stroke.
That's great. Thank you.
Definitely.
Great. Well, that's all the time we have for today. I'd like to thank my guests, Mallory Shonk and Vicki Alsup. And if you'd like more information on stroke recovery, please refer to the resources page after this program. And join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you by Harford TV. Watch what matters.